In this video, we will demonstrate how a problem related to the number of symptoms treated by a doctor in a day may be modeled as a probability generating function for a compound distribution. The context for this problem is the Medical Center Hospital of Odessa, Texas, a nonprofit hospital serving the greater West Texas region.
My name is Chad Donovan. I'm the Assistant Divisional Director of Acute Care at Medical Center Hospital. We serve 17 surrounding counties. We are a Level 3 trauma center. We also have a lot of outlying area town hospitals that feed a lot of patients through our ER or direct admissions. The emergency room is our main source of admissions. Probably anywhere from 70 to 75% of our admissions come through the emergency room. Once they go through the emergency room, the doctor determines if that patient should be admitted or sent home from that point. We have all kinds of patients that come through there, anything from pediatric patients with colds, fevers. We have traumas, car wrecks, just whatever you can think of. We pretty much get those types of patients. We have medical surgical units that take care of your basic sick patient. We have telemetry cardiac units that take care of the cardiac patients that have interventions done, that have anything that has to do with their heart, even trying to control their heart rates with medications or with other types of devices. Really, our emergency room is the main place to where, like I said, 70 to 75% of our patients come through there and are admitted by those physicians, and according to what's going on with their situation, their illness, they put them through to the proper unit that they need to be admitted at. Also, the length of stay with these patients also is determined by the type of illness that they are diagnosed with. The length of stay can be anywhere from a 23-hour observation patient to where they go home the next day. They just want to run some tests, rule some things out, or they can be in the hospital for 3 to 5 days according to DRGs and all these other things that insurance companies use to determine how long the patient should be in the hospital for that illness. We also have patients that are here even longer than that. We find some that, when we're looking for nursing home placements or long-term care placement, they can stay in the hospital anywhere from 5 days to 25 days. Of course, that is a constant struggle trying to find placement for patients outside the hospital. We keep an average daily census up here of around 23 to 24 patients. The patient load up here is anywhere from one nurse having 3 to 6 patients, depending on the type of patient, how sick the patient is, and the actual patient load that nurse can carry. Patients turn on the TV, they select the program they want to watch according to their diagnosis, to what's going on with them. Even if they just want to relax and watch waterfalls or hear, relaxing music, that's all through that system there. We have these whiteboards here. These basically give the patient the information on who the unit director is, what their nurse is for the day, who their nursing assistant is. Like right up here, we put a lot of important information, like if they want their daughter's phone number, if they, can't remember their family's numbers, we put their numbers up there, or specific dates for certain things, or if they have tests or anything going.
The expected length of stay for a patient at a hospital is an important metric for scheduling beds, doctors, nurses, etc. The Medical Center Hospital would like to determine the expected length of stay for patients arriving to their general care units. Though the problem presented in this video is representative of one in that industry, keep in mind that all data given in this video is fictitious and for illustrative purposes only. Let X equal length of stay for an arriving patient, and Y equal diagnosis class of the arriving patient. The length of stay for an arriving patient depends on the diagnosis that the patient has. For simplicity, let's assume that the patient can have one of 4 possible classes of diagnoses, and from historical data, we know the probability of these diagnoses are as follows. In addition, we know that the expected length of stay for the different diagnoses classes are as follows. The desired information or problem is, what is the expected length of stay for an arriving patient? The problem of obtaining the expected length of stay for an arriving patient may be found by using conditional expectation, in particular using the following equation. So to solve this problem, one would simply need to substitute the expected lengths of stay per diagnosis by the probabilities of the diagnosis.